Hi, my name is Lisa Mulkey, and I'm a registered nurse. I developed a teaching plan about the elderly population and diabetes. I discovered over 11 million people 65 years and older have or potentially have diabetes. Many of these individuals are not even aware that they have the disease, even with the symptoms. I have chosen a 66-year-old Caucasian female who was diagnosed with type 2 diabetes and coronary artery disease in 2003. She was having symptoms of basically of having a heart attack, and went to her primary care doctor, who sent her to a cardiologist and tried to do stents, at which time they determined that her blood sugars were well over 300 and couldn't get the stents in due to her sugars being so high. So they waited a few days and had to go back in and put the stents in when her blood sugars had come down a little bit. So at that point, she was diagnosed with diabetes and with coronary artery disease. She's been on oral medication since that time, and has progressed to insulin. The insulin is scheduled twice a day, which is her long-acting. And then she takes Novolog at mealtime. She's supposed to check her blood sugars before meals, and then she is to count her carbs and adjust her insulin injections based on the carbs that she's eating of a sliding scale. She frequently forgets to test her blood sugars before she eats, which is a problem. And she will test it after eating several bites, or she will wait till after eating and test. At which point, usually her blood sugars are still well below the sliding scale. She'll count her carbs that she ate, and then she will she'll give herself her insulin. She does have signs and symptoms of high blood sugars. I did give her a pamphlet regarding those symptoms. This is the high blood sugar one, which is signs and symptoms are being very thirsty, needing to pass urine more than usual, being very hungry, sleepy, blurry vision, and infections or injuries heal more slowly than usual. She also has where when her insulins reach 400, 500, and they have reached up to 600 occasionally, she doesn't feel good at all. She just has this, she's nauseous, she just does not. She has the symptoms of low blood sugar, which the low blood sugars are, I gave her this little pamphlet as well. And, signs and symptoms of low blood sugar are shakiness, sweaty, dizziness, confusion and difficulty to speak, hungry, weak or tired, headache, nervous or upset. And there, even when she has those high blood sugars, she has the signs and symptoms of low blood sugar. So she will take her blood sugar, and she's really like she gets concerned because she's like, I feel like I have low blood sugar, but then I test my blood sugar and it's extremely high. So at which point she starts giving herself the insulin based on her recommended dosage for sliding scale that her endocrinologist has recommended or has prescribed her. Now, the other problem that she has is the carb counting. She works full time, and she goes to lunch every day from 12 to 1, which is rush hour for everybody. And so she's rushing to get something to eat and then get back to work. So in that midst, she forgets not only to test her blood sugar, but she also forgets kind of what she's eating. And so she's like, oh, I don't remember what I ate. Or she'll say, oh, I kind of remember. But I don't have this huge pamphlet, which I have a copy of. This is page 1 of 6 that her physician gave her of carbs. And basically, the main carbs that she really needs to watch are breads, crackers, grains, and starchy vegetables. So she will say, oh, I had a piece of bread, and that's 15 grams. And so she knows that one by memory. She's got that one down. Now, if she goes and has rice is a cup. A cup of rice is 45 grams for 1 cup. But trying to figure out what a cup is when a restaurant gives you a huge plate, that is very hard. And so she has tried to figure out that 16 tablespoons is 1 cup. She's tried to figure that out. And she'll take the tablespoon and she will try to figure out, did I have 45 grams? Did I not have 45 grams? And so that is very difficult for her. The biggest problem for her is her testing her blood sugars. She complains that it hurts. She's tired of testing. It hurts her fingers. Her fingers get very sore. And then giving herself the insulin over and over again in her abdomen. And we have discussed that she can go into her thighs, into the back of her arms. And of course, she's discussed that, I've done that, and those hurt worse than the abdomen. Abdomen is the best place, and I live with it. She does have bruises on her fingers. She does have bruises on her abdomen. We have talked about carbs, the carb counting, and we're going to develop making this pamphlet smaller so that she can carry it in her purse. And then we're also going to put alarms on her phone so that she will remember. It will be a reminder that she does need to take her blood sugars at mealtime, especially at lunch. Supper time is not a set time, so she's like, yeah, I can set an alarm, but that alarm's not going to necessarily mean anything to me. And so that may be an issue that we may have to work out as we go along, that it may be that we set the alarm at 5 o'clock and she's just going to have to remember that at 5 o'clock she's going to need to test her blood sugar, regardless of whether she is it's mealtime or it's near mealtime. That way she's she already has her blood sugar tested. And so that is my teaching plan for my 66-year-old female. I hope this concludes my teaching plan. This was my implementation of my teaching plan for this beautiful lady. She is doing very well with her carb counting at this point. It's not 100% perfect. And according to articles, it's not going to be. According to the American Diabetic Association, it's not going to be. But as long as she is trying really hard, and her numbers are really showing it, and that's the big thing. We're not seeing numbers in the 400s, 500s, 600s with blood sugars, and that's a good thing. She does go to her endocrinologist at the end of the month, which I'm hoping her A1C has dropped some, and will show him that she is trying even harder. So thank you and have a great day.